Welcome back, everyone. It is 12:30 and we have two more sessions that are going to be great. Just as the first ones, we're going to be hearing from USDA and CDC. And with that, I'm going to turn over to our moderator for this next afternoon, our chair, Dr. Paul Plummer.
Thank you, Dr. Mossmar. And I also welcome everybody back, council members, as well as those watching online. This afternoon, we're going to continue with a module from the U.S. Department of Agriculture, where we will explore the multiple ways that our federal partners engage globally to address AMR within the agricultural sector. We'll first have a brief introduction from USDA's alternate representative to the PACCARB, Dr. Chelsea Shively. Then we will hear from Dr. Rosemary Sifford from the APHIS Veterinary Services, Dr. John Griefer from the APHIS Plant Protection and Quarantine Office, Dr. Amy Delgado, also from the APHIS Veterinary Services, and finally, Dr. Micah Rosenblum from the Foreign Agricultural Services. When you're ready, Dr. Shively, please feel free to proceed.
Good afternoon, everyone, and thank you for this opportunity to introduce the United States Department of Agriculture International Antimicrobial Resistance Activities. Next slide. I want to start with the new USDA strategy to address antimicrobial resistance, published just last month during World Antimicrobial Awareness Week. This document includes the top 10 priorities at USDA for addressing antimicrobial resistance, and you can use this QR code to access the report. Next slide. Let me draw your attention to Area of Focus 3, where we highlight that we want to improve communication and collaboration within USDA and national, regional, and global partners to address antimicrobial resistance risk. We will do this by building trust, disseminating information with context, and delivering science-based solutions. Next slide. As we have heard already today, antimicrobial resistance is a global challenge given that resistant microbes do not respect borders, and people now move around the globe every day. It is also important to consider agricultural trade, with animals and agricultural products moving internationally. In 2022, U.S. agricultural exports reached nearly $200 billion. Science and risk-based standards help to protect health and ensure fair trade. Next slide. The World Trade Organization has an agreement on sanitary and phytosanitary measures, or SPS, with the dual purpose to protect human, animal, and plant health, and to ensure fair practices in food trade. The SPS agreement encourages members to base their sanitary and phytosanitary measures in international standards, guidelines, or recommendations, all based on science and risk, and to participate in their development and review. The agreement also mandates the SPS committee to develop a procedure to monitor the process of international harmonization and to coordinate with the relevant organizations. The World Trade Organization has identified the Codex Alimentarius Commission, or Codex, as the standard-setting body for food safety. Dr. Don Prater of the Food and Drug Administration presented on Codex at the 19th PACCARB public meeting on November 30th, 2021, and his presentation can be found on the archived PACCARB webcast from that meeting if you would like to revisit his presentation and learn more about the work of Codex on antimicrobial resistance. The World Organization for Animal Health, or WOA, is the standard-setting body for animal health and zoonoses. And you will hear more about how USDA engages with WOA from Dr. Rosemary Sifford, who serves as the Chief Veterinarian for the U.S. The International Plant Protection Convention, or IPPC, is the standard-setting body for plant protection. And you will hear more from Dr. John Griefer, the Assistant Deputy Administrator of APHIS's Plant Protection and Quarantine Group, and how USDA engages with IPPC. Next slide. In addition to the more formal relationships USDA has with the SPS standard-setting bodies, USDA also engages with multiple international organizations to address antimicrobial resistance. You will hear more about activities at the USDA Foreign Agricultural Service from Micah Rosenblum, including capacity building and training. You will also hear from Dr. Amy Delgado, who is the new USDA liaison for animal health to FAO, about some of the work that the FAO is doing to address antimicrobial resistance and how USDA APHIS engages with the FAO. Beyond all of that, USDA participates in multiple organizations that facilitate the technical information sharing about antimicrobial use in animals and antimicrobial resistance. For example, there are several groups that meet regularly to discuss WOA AMR activities, including the Animal Health Quads Alliance Antimicrobial Resistance Network, which consists of Australia, New Zealand, Canada, the UK, and the US, as well as the WOA region of the Americas. USDA also participates in multiple working groups of the Transatlantic Task Force on Antimicrobial Resistance, or TAPFAR, which we've heard about today. And several members, including myself, recently traveled to Luxembourg to meet with other government representatives of TAPFAR across the One Health spectrum. Next slide. Thank you again, and I will now turn it over to Dr. Rosemary Sifford, the Deputy Administrator of Veterinary Services and the Chief Veterinary Officer for the United States, to talk more about the World Organization for Animal Health. Thank you.
It's great to be with you this afternoon to talk a little bit further about the ways that we engage with the World Organization for Animal Health. Next slide, please. So in general,
having a hard time hearing you. You could turn up the volume, please.
Is that any better at all?
A little bit.
I may have to try to speak up. So in general,
I'll cover some basic information about the structure of WOA and their standard setting process, and then move into more specifics around their work with antimicrobial resistance. Next slide, please. So the World Organization for Animal Health, known as WOA and previously known as OIE, is an intergovernmental organization that works across borders to improve the health of animals and therefore our future. The organization was founded in 1924 in response to a cattle plague called rinderpest, which swept across the globe, ravaging livestock and devastating livelihoods. The crisis clearly demonstrated how animal diseases pose a threat to food security and economic growth, and that the global community needed to address them in a coordinated way. So WOA comes from an international agreement to fight infectious animal diseases in solidarity, and now has 183 member countries. The organization is headquartered in Paris, France, and maintains permanent relations with over 70 international and regional organizations, as well as having regional and sub-regional offices within the organization worldwide. Together, the organization and its members coordinate the global response to animal health emergencies, the prevention of zoonotic diseases, the promotion of animal health and welfare, and better access to animal care. The information on the screen now is from the WOA website, and if you'll click next slide, we'll just point out that this definitely demonstrates how antimicrobial resistance is currently one of the top priorities for WOA. Next slide, please. So a little about the structure of WOA. The highest governing body within WOA is the World Assembly, which is made up of 83 delegates, one from each of the member countries. The delegates are generally the chief veterinary officer from each country, and I am the delegate for the United States at this time. The delegates meet at least once a year in the general session, which is held in Paris for 5 days every year in May, and voting is conducted on all of the standards and other issues brought before the organization. Voting is done through the democratic principle of one country, one vote. The members are very committed to applying the WOA animal health and welfare standards. Each member appoints representatives to the organization, as I mentioned, the national delegate, and then that delegate is responsible for bringing information from the member country to the WOA in the general session as the overall body. WOA also has other structures of governance, which include the council, specialist commissions, regional commissions, and working groups. I'll talk a little bit more about each of those organizations and how we have input and representation in those as we go through the presentation. Next slide, please. So this slide demonstrates the WOA standard setting process, and the two things that you can notice right away is that it is complicated and there are lots of opportunity for input. So WOA has been designated as a standard setting organization for animal health and zoonoses by the World Trade Organization. And this graphic shows how that process works. So the first thing that has to happen is a need is identified. That need can come through a number of pathways. It might be from a delegate speaking out in the general session and identifying something that they'd like to see changed within the standards. Or it might come through one of the specialist commissions as they review documents and look for what needs to be updated in the standards and set their work program. Additionally, it might come through a delegate from a member or a stakeholder organization, and delegates can send information to WOA, to the headquarters, and to the specialist commissions through letters and other correspondence throughout the year. So once the need is identified, that information needs to go to the specialist commission for them to consider whether that need justifies a change into one of the existing standards or a new standard needs to be established. The specialist commission themselves might seek input from others to get further information about the need. This can include other specialist commissions, the reference laboratories or collaborating centers, or other groups of subject matter experts such as the working group and ad hoc committees. Once the specialist commission has identified a change in a standard that they would like to put forward, they make the revisions to the standard, and then they send that out for review and comment. These standards go to all the member countries for their review and comment. The member countries can seek input from their stakeholders. Once we have put together our comments on any proposed revision, we return that to the specialist commission. It goes through 2 cycles of this review and comment period before it comes back to the specialist commission for them to put together what is the version that would be put before the general session to be adopted or not. Generally, by the time it makes it to the general session, we've had ample time to comment and standards are adopted. But it is not unheard of for standards to not be approved and to have to go back into the process, or for there to be revisions made on the floor during the general session. Next slide, please. So we'll go into a little more detail about the comment cycle itself. As we mentioned earlier, the general session is in May, and you can see that in the orange block at the bottom of the screen. And that sort of is the easiest place to think about where to start and end of the cycle. In May at the general session, some standards are adopted and added to the overall code, and others may have other conversation or things that we need to do. We have an opportunity in June to send comments, to request comments from our stakeholders and submit those comments before the specialist commissions meet again later in the year. So the gray boxes on here are the times when there are opportunities that we share the information from WOA with stakeholders here in the United States. They send their comments back to us, and then the blue boxes represent us in veterinary services, taking those comments and consolidating and collating them to share back with the specialist commissions for their meetings. And so the specialist commissions meet 2 times a year outside the general session and go through the comments they've received and make adjustments to the documents. They send that information from those adjustments back out to us. We share with stakeholders for comment, and then they go back to the specialist commission. And so on the slide before, when I mentioned 2 rounds, that's 2 annual rounds. And so within each of those annual cycles, there are multiple opportunities for comment, as you can see here. So 2 of these annual cycles happen before the last one, where a comment, a revised code may go forward for approval at the general session. Next slide, please. So here I'll dive a little bit more into the different ways we engage with WOA through the different parts of the organization. So we mentioned the stakeholder engagement. That really happens through that comment process. Most clearly, we try to distribute the codes and the standards that we receive from WOA and the planned updates broadly and receive input from stakeholders that we know have subject matter expertise in the area where the standard is being revised. We also work very closely with other countries in this process as well to share with some of our allies where we're receiving comments and to learn from them where they're receiving comments. So we have a pretty consistent cycle of gathering up comments from stakeholders and then sharing those back with WOA for further consideration. Another way that we engage with WOA is at their headquarters in Paris, France. The headquarters staff there is overseen by the Director General. And a number of countries have secundees who work within the staff. The United States has one. Each of our secundees works there for 3 years. Currently, our secondee is Dr. Joyce Bowling Hayward. She will fill a position in the standards department, which means that she will be engaged in many of the conversations that they have there in headquarters as they are reviewing and revising standards and sharing that information out for comment to all the member countries. Dr. Bowling Hayward is new as our secondee. She's just about to begin her term in Paris. We try to keep a secondee there on an ongoing basis, and our most recent secondee just finished her term up earlier this year. In addition to that collaboration, we do work very closely with the WOA Council. The council is the body that works directly with the Director General to look over budget and administrative and provide input and advice on those types of areas. The council is made up of 9 members. That includes a president, a past president, vice president, and then 6 members that represent the WOA regions around the world. The current president is from Paraguay, and the Americas region has another council member from Nicaragua. We engage very routinely with both of these council members through the region of the Americas. Additionally, the past president is from Australia, and we collaborate with Australia very routinely through the Quads Alliance. As Dr. Shively mentioned before, the Quads Alliance is made up of Australia, New Zealand, the United States, Canada, and the United Kingdom. Additionally, the specialist commissions are the groups that are responsible for reviewing standards and reviewing the comments and then offering the revisions to the standards that would come before the general session. There are 4 specialist commissions. Currently, the United States holds the presidency of the Scientific Commission. Dr. Cristobal Zubeda, who is a veterinarian with APHIS International Services, holds this position. And so we engage through our comments with the specialist commissions, and we engage as we try to have members from the United States on the specialist commissions. The specialist commission positions are 3-year positions, and this year we will be voting in 2024 for new specialist commission members. In the United States, we are supporting Dr. Zubeda to carry out another term, and we will support candidates for specialist commissions as well for the aquatics, the terrestrial animal, and the biologics specialist commissions. The regional commissions are designed to provide leadership for each of the regions where WOA has staff. So the Americas is all in one region. I'm currently serving as the vice president for the Regional Commission of the Americas, and that commission really just helps to guide what topics we're going to cover within our regional conversations, and then we try to reach consensus as often as we can so the Americas can provide one concerted opinion from the Americas on most of the topics. So the Regional Commission is important for directing the conversation and having us cover the topics that are of most importance to our region. We also engage routinely with WOA through other alliances. We've already mentioned the Quads Alliance. Another alliance that we are a part of is the North American Animal Health Committee, which consists of the CBOs for Canada, Mexico, and the United States. We also work together to try to establish joint opinions. And in addition to these types of alliances, we work closely with organizations that we might not be a direct member of, but that we work very closely with, such as the Inter-American Institute for Cooperation on Agriculture. And then finally, WOA does have collaborating centers and reference laboratories that they recognize. We have a number of collaborating centers and reference laboratories in the United States, and we ensure that we work closely with them to take comments during the periods that we have comment. They also have working groups and ad hoc groups that can be formed for a long-term or short-term basis to address specific topics. They do have a permanent working group around antimicrobial resistance. We provide subject matter expertise to many of these working groups on a routine basis. And then finally, the focal points. Each country is asked to have 8 national focal points that address specific areas, and WOA routinely has meetings at the focal points to cover specific areas of concern. 2 of the focal points, one is for veterinary products, and there's another focal point group for antimicrobial resistance. Next slide, please. We'll dive just a little into WOA's specific work around AMR activities. WOA developed a strategy on antimicrobial resistance and the prudent use of antimicrobials in 2016. And they highlighted the importance of the quadripartite partnership, which has been mentioned with FAO, UNEP, WHO, and WOA. They also have a permanent working group on antimicrobial resistance that we just mentioned. And they have developed 4 key pillars that they have established as the key pillars for curbing the spread of antimicrobial resistance. And the key pillars are what are listed here on the screen: supporting good governance and capacity building, encouraging implementation of international standards, strengthening knowledge through surveillance and research, and improving AMR awareness and understanding. If you would like to further explore the WOA AMR strategy, it is available on the WOA website. Next slide, please. And then this slide has quite a bit of information. This ties us back to the standard setting process. WOA has a number of standards related to controlling antimicrobial resistance that are found within chapters in the terrestrial and the aquatic animal health codes, as well as the terrestrial animal health manual. And so, as we were describing earlier, the process to comment on these chapters and provide input as they are developed. We have provided comment on all of these as they have been developed. And currently, the chapter 6.10 of the Terrestrial Animal Health Code, titled Responsible and Prudent Use of Antimicrobial Agents in Veterinary Medicine, is being updated. And so we are currently in the process of providing comments, reaching out to stakeholders to gather up those comments and provide those back to WOA. Next slide, please. Another activity that WOA has undertaken with regard to AMR activities is collecting information on the use of antimicrobials in animals. They've been collecting this type of information since 2015. Last year, they transitioned it to an online portal called Animuse, which is when they built the antimicrobial use global database. This is a key component to their strategy for curbing AMR. It facilitates national, regional, and global monitoring of antimicrobial use and gives the opportunity for countries to monitor the effectiveness of their interventions to reduce and optimize the use of antimicrobials over time. Within the United States, Veterinary Services works very closely with the FDA Center for Veterinary Medicine to submit data annually to WOA about antimicrobial sales in the United States. With that, I will, next slide, just thank everyone for the time to share our interactions with WOA this afternoon and look forward to the Q&A session. Thank you.
Oh, Chelsea, I see the slide up here, so I'm assuming you've given me the green light to proceed.
Yes, thank you.
Yes,
Well,
please.
thank you so much, Rosemary. We appreciate you, your presentation. We'll move on to Dr. John Grefer, USDA. The floor is yours.
Thank you, and good afternoon, everybody. Yeah, I was asked to give a short briefing about the International Plant Protection Convention and what it's doing in the AMR space. We're kind of a newcomer in this space. We recently started talking about One Health and the importance of trying to join that dialogue, and it's bringing talk about plant health in this larger context is something we started at the IPPC in 2019. And so I appreciate the opportunity today to talk a little bit about the IPPC and some of the things we're doing specifically relative to AMR. But before I dive into any further, let me just explain a little bit about the IPPC context here. So what is the IPPC? Could you go to the next slide, please? So first of all, it's the IPPC is a treaty that goes back to 1952. Its basic aim is to prevent the spread of plant pests that threaten plant resources, plant commodities, any type of plants, and to promote measures and other collective strategies for dealing with those pests. Again, the emphasis is to prevent the spread of pests that may be harmful not only to agriculture, but forests, biodiversity, the environment. Today, the IPPC is composed of 185 signatory countries. It started with 8 back in 52. We've grown. Beginning in the 90s, went from about 120, went all the way up to these numbers we see today, largely because of the WTO, the World Trade Organization, that recognized the primacy of IPPC standards to drive and to guide trade in plant commodities. And so countries recognizing the enhanced importance of international standards and the IPPC in that process were in a way influenced to come to the IPPC and become a member. Countries at the IPPC are represented by their senior plant health official, referred to as these agencies within countries, the national plant protection organizations. All of them are headed up by a chief plant health official that then represents their country at the IPPC. Plant resources covered by the IPPC include cultivated and non-cultivated plants, as I mentioned, forests, aquatic plants, and biodiversity. And in terms of what is defined as a plant pest under the convention, it's any species, strain, or biotype of plant, animal, or pathogenic agent injurious to plants or plant products. Next slide, please. So another key point that, and I've already, I think, made this, but needs emphasis, is that the IPPC is the primary international body that produces international plant health standards to guide and ensure safe trade in agricultural commodities. And the processes around the development and the adoption of these standards is pretty much what was described to you by the previous speaker in terms of work and the standards developed by the World Organization for Animal Health, very similar. So I'm not going to repeat it. Process-wise, the way they're shared, the way they're vetted, and then ultimately the way they're approved is almost identical to what happens through the WOA. The IPPC's overall goal of safeguarding plant health is supported by key principles and standards such as the use of science-based measures, risk analysis, pest surveillance, and early pest detection, the use of consistent pest identification methods, pest reporting, and here's the most important part in terms of the trade and trying to prevent the spread of pests, is through the sound inspection and certification practices that are used and agreed to before shipments are in terms of imports and exports of plant commodities. Next slide, please. So AMR in the IPPC context, plant health officials recognize the antimicrobials play a critical role in treating diseases of food-producing animals. However, the IPPC community did not want to overlook any potential risks associated with AMR in the phytosanitary context. So in 2019, the IPPC community directed its secretariat to undertake a study to determine the extent of antimicrobial product usage in the plant health area. The IPPC the secretariat developed a survey to collect information on the use of antibiotics for plant protection, plant production purposes. The survey was launched in May of this year and was available in all United Nations languages: Arabic, Chinese, English, French, Spanish, and Russian. And the survey was designed specifically to collect information on the use of major antimicrobial products, such as streptomycin, tetracycline, oxy, tetracycline, amoxicillin, and several others. Next slide, please. So some of the findings, a total of 66 countries responded to the survey. So as I mentioned, we have 185 member countries, and we nearly got 50% response, which isn't bad these days. There's been a lot of survey fatigue. But in any event, that's what we got out of this particular survey. They came from, generally they're distributed, so we got a flavor from all the major regions of the world. So it wasn't all concentrated in one or two regions. It's fairly distributed. The 66 responses came from fairly even distribution across the regions. 46 of the countries that responded, nearly 70%, indicated that they do not use any major antimicrobial products in plant production and protection. 20 of the countries, that's the other 30%, indicated that microbial products are either being used or registered for use in plant production and protection. So key number here, which is this no use, 70%, 2/3, almost not reporting any use, at least of the major antimicrobial products that we were looking at. The antimicrobial products that were indicated as the most in use were streptomycin and castomycin, at least being registered and or used as the two most common. The contracting parties indicated antimicrobial products are used or registered for use on approximately 35 species of fruits, vegetables, and cereal. The one that were mentioned the most was tomato, potato, and rice. And in terms of what they're used for, and what we were seeing is antimicrobial products mainly used for bacterial diseases such as bacterial soft rot, fire blight, bacterial canker, bacterial rot, bacterial spot, and bacterial fruit blotch. And in terms of quantity, of antimicrobial products used per year, there was a significant variation was observed in the reporting from countries, from as low as half a ton per year among a number of the smaller agricultural producing countries to up to 13,000 tons per year. Next slide, please. So the main things we've gleaned, at least from this initial survey, is that that the survey results seem to show that the number of countries using antimicrobials for plant production and protection purposes is low, relatively low, as around 70% of the countries surveyed declared no use of these products for plant protection. The use of antimicrobials is very variable, and we feel that at the IPC we need to analyze this a bit further. Except for some countries with very high levels of agricultural production, approximately 35% of the respondents reporting using 1 or 2 antibiotics, but less than 5 tons of it per year. So at this stage, the Secretariat is suggesting that we gather some additional information to better understand AMR in the plant health arena, and especially to begin to identify possible cases of resistance. Next slide, please. So looking ahead here, what we expect this next year in terms of what IPPC is going to be doing around AMR is number one is IPPC members want to take a close look at fungicides. We think there's probably more significant issues or concerns that we want to investigate with fungicides. So we're going to be tasking the Secretariat to develop a survey around fungicides. And the second area of follow-up work is going to be to take the survey data we got this year and do some further analysis. And specifically, we want to clarify if the responses that we got this past year on the survey and the usage is related to authorized or in registered products, or is it reflect actual known use? There's a difference between things that are registered but not used versus what we want to understand more clearly what is actually used in practice. So we're going to dig into that. The second thing we want to look into, which is really the heart of the matter, is to look at incidents or information or evidence of actual cases of antimicrobial resistance in plant health. And then lastly, begin to think about, to the extent there are cases of antimicrobial resistance, is to begin to identify solutions to mitigate the risk of AMR and the use of best practices as it relates to the use of these products in the plant production and protection arena. So the IPPC Commission, which is the overall body that meets once a year to set the work program, set the priorities at IPPC, we'll be meeting in April, and it'll be in April that we talk more about AMR in the plant health space, and we will be proposing that this additional work that I just described to you be undertaken in the beginning next year. And I will stop here, give the floor back to the facilitator, and wish everyone a happy holiday. Thank you.
Yeah, thanks so much, John. Appreciate that. So I'm Dr. Amy Delgado, and I am going to transition us now to talk a little bit about the Food and Agriculture Organization. The FAO is a specialized agency of the United Nations, and it leads international efforts to defeat hunger. So that's its broad mission. And within that, it has a lot of different areas and a lot of different work that happens across that space. The FAO currently has 195 members, including 194 member countries, plus the European Union. And so my role as a employee of APHIS Veterinary Services, I'll be transitioning beginning next year into a liaison position within FAO based in Rome to continue to work in coordination and engagement with the FAO. And so I'm going to take the opportunity today just to highlight some of the work that's happening at the FAO and places where we see opportunities for continued support and engagement with that organization. Next slide, please. So as many of you know, the FAO has had an action plan and been engaged in the AMR space for quite some time. Their action plan was published in 2021, and all of the member countries agreed to it. The action plan actually has two primary goals: to reduce AMR prevalence and slow the emergence and spread of resistance across the food chain, and for all food and agriculture sectors. And then secondly, to preserve the ability to treat infections with effective and safe antimicrobials to sustain food and agriculture production. Next slide, please. So when we look at those two primary goals shown here at the top and those light blue bars, there are a number of outcomes that are based under those. So sometimes these are called pillars, sometimes outcomes, but there's basically these 5 areas where FAO is focusing their efforts in order to see targeted improvements and change. And so these range from changing practices, strengthening evidence base and research into this space, adoption of good production practices and minimizing the need for antimicrobials, responsible use of antimicrobials, as well as strengthened governance and resource allocation. So you can see obviously there are really broad areas, and there are a number of activities that span across that space. FAO is working at the very local level, national, regional, as well as global level to support these different outcomes. And so that work happens in a number of ways. They do a lot of training, a lot of capacity building, and direct engagement with their partners in country. And there's certainly a lot of different ways that inputs into this work come from the member countries and from donors and from other partners that they have across the world. So I'm going to speak a little bit in depth about some of the different tools that FAO has developed as part of this overall action plan in order to empower countries to make change and to help them make clear and sustainable progress toward these outcomes. Next slide, please. So the first tool that I wanted to highlight is the progressive management pathway for AMR. If you're familiar with FAO, you know that they like their PMP tools. They're used for a number of different issues and diseases of concern. And these tools are really powerful because they identify a clear path forward for making sustainable small steps improvements to an issue. So for many countries, writing a national action plan for AMR is not their biggest challenge. It's really the issue of implementing those plans and demonstrating sustainable action. And so that's where the PMP for AMR is really meant to be a tool to support those efforts. It's a guide to help countries put those national action plans into action. This approach allows specific sectors within a country to make step-by-step improvements toward the sustainable use of antimicrobials and management of AMR. And those improvements can start as really small-scale initiatives and evolve into broader actions, perhaps in priority sectors, and eventually develop into fully fledged One Health national action plans addressing AMR in all of the food and agricultural sectors across the country. So in that way, the tool is designed to enable countries and those specific sectors to work very progressively towards optimal and sustainable use of antimicrobials. This tool has been applied in 40 countries already, and most action plans and some of the feedback that they've heard is that most action plans in those countries are very human focused. And so this tool is allowing them to support a shift towards including and addressing agri-food systems as part of that process. Next slide, please. Another key area for FAO is around surveillance and monitoring for antimicrobial resistance. And so one of the ways that FAO is supporting countries in building and consolidating their AMR surveillance and laboratory capacities is through the Atlas tool. So this is the FAO assessment tool for laboratories and AMR surveillance systems. It's meant to help countries generate and analyze high-quality epidemiologic data within national AMR surveillance systems in the food and agriculture sector and interpret those findings across sectors. You can see that the tool has two modules. So there's a surveillance module and a laboratory module. They are administered basically at the same time. There's two separate questionnaires filled out by two different respondents within the country. The tool is now available in 4 languages, and it was first piloted in 2016. Up to now, I think 44 countries have hosted assessment missions, and FAO continues to work to ensure that they have plenty of assessors to partner with this. They're also working really closely with the World Organization for Animal Health to coordinate these country-level assessments under a One Health approach. Next slide, please. So when we look specifically at what this tool does, you can see that for each laboratory or for each of the surveillance areas, they have these 5 key areas that they're assessing. And then they go through and assign a stage to those areas so countries sort of understand where they're at, both on the laboratory side as well as their surveillance side. And then the specific steps for improvement are identified through this process. So countries have an idea of what's needed to make change, and then they work together to prioritize those actions with the goal of building a reliable national AMR surveillance system. And then this tool also has a built-in progressive improvement pathway that allows them to monitor their improvements over time based on those priority actions. Next slide, please. So the third thing I wanted to highlight is another major initiative that FAO is undertaking, and this really has just started since early 2022. So it's in a prototype stage, but it's an international FAO surveillance monitoring platform called InFarm. The goal of the platform is to support countries in collecting, analyzing, and using their AMR data from animals and food for AMR surveillance at the national level, and then to facilitate the sharing of that data for global surveillance. Its idea is that it would also support data sharing into the global tripartite integrated system for surveillance of AMR and AMU. So the idea is, as all of these different organizations are working and touching AMR data or antimicrobial use data in different ways, there needs to be a process for bringing that all together in order to get the big picture. And so FAO is working to address some of the gaps in data collection that have existed. So we've already heard the World Organization for Animal Health collects antimicrobial use data and animus. And so FAO works to collect AMR and AMU data in crops and to bring antimicrobial resistance data in animals as well as antimicrobial use data in crops and start to bring that information together into an integrated system. And so that work has been funded by a joint action fund for quadripartite activities and is currently ongoing. So this approach, and like I said, it's very new, is not just about collecting data, but it's really about strengthening countries' abilities to collect information. So it certainly leverages the work that's been done in Atlas and that tool to help countries establish and have sufficient laboratory capacity, trained experts, and all the things needed to have a robust surveillance system. And to have a data infrastructure to put that information into. So InFarm is going to be designed to allow countries to have a private repository of their data and to work with that, and then they can choose whether or not they want to share that data globally. So it's still in a pilot phase. They're working with a mix of kind of real and fake data, and next year they're planning to do the global rollout and capacity building. Next slide, please. So the last area I wanted to touch on was Renofarm, reducing the need for antimicrobials on farms initiative. This is also a new initiative that FAO is launching. It's a 10-year global initiative that's really focused on how do we reduce the need for antimicrobials. And the aim is to pull together all of the different skills and tools and techniques and training that FAO has developed and bring them into the context of improving animal health, reducing the need for antibiotics. And so you can see all of these different measures that come together in good production practices, biosecurity, vaccination, nutrition, all of the different ways to improve animal health and reduce the need for antimicrobials. This is going to be a way to help bring together ideas and resources, identify funding needs more clearly, and just really have a platform for displaying that information. 3 countries have been piloting work through this platform this past year. So FAA is currently working on the feedback from those 3 countries and will be updating the materials. And they're looking to launch early next year with a toolbox and some country level roadmap templates that will be a part of the Renofarm. Next slide, please. So certainly there's a number of work and activities happening across FAO. There remains opportunities for U.S. engagement in this space. As USAID pointed out, I'll give them a shout out. When I was speaking to FAO about this presentation, they were quick to point out that the U.S. government has been a critical partner for them in funding and supporting different missions and work in the field, and they're partnering with countries. There is an ongoing need for financial support across that space. In addition, there's certainly opportunities in the quadripartite collaboration and U.S. engagement in that place, as Dr. Sifford has already pointed out today. One area is considering serving as an observer in the AMR multi-stakeholder partnership platform. There's also opportunities to engage with a group of friends on tackling AMR and the quadripartite coordination group. So as I transition to my role there at FAO, I anticipate that we'll continue to have conversations and engagement around those spaces. And that's it for me. Thank you.
Thank you. So my portion covers 3 elements: an overview of the Foreign Agricultural Service, FAS. I'll also share some examples of our CARB implementation, and I will also cover some challenges that we're facing. Next slide, please. Thank you. So FAS is a trade agency with a mission to promote agricultural exports. Our primary focus is U.S. exports. Next, the FAS is a foreign service agency with our headquarters in Washington and 96 overseas offices and American embassies throughout the world. That's where our foreign service officers and locally employed staff serve as our in-country eyes, ears, and advocates. Among our services and products, we offer customers geographic and trade policy expertise, estimates of agricultural commodity production, and analytical reports on global market conditions and international trade flows. FAS also administers a robust toolbox of international programs focused on trade. While many USDA agencies and offices engage in international activities, and you just heard some of them from our APHIS colleagues, FAS is the center of gravity for USDA's international programming. I will now just summarize, next slide, please. I'll summarize how we align our work to help support CARB. First, I think it's important to just note here that strategic alignment is very important for understanding our agency's contributions to CARB, because FAS does not administer an international program for CARB or even for global health security per se. Instead, some FAS programs or activities align with CARB objectives, particularly Target 5211 on capacity building for prevention of antimicrobial resistance. For example, the Faculty Exchange Program, FEP, it pairs instructors from veterinary colleges in priority countries with mentors at U.S. host universities to improve veterinary curricula and instruction in their home countries. Depending on the fellow's interests, their scope sometimes includes curricula and instruction on antimicrobial stewardship and uses. In 2022, that program shifted its focus from Africa, where it had been operating for a couple of years, to Southeast Asia. And earlier this year, we hosted fellows from the Philippines and also Vietnam. We anticipate hosting additional Filipino and Vietnamese fellows under the Faculty Exchange Program next year. While the Faculty Exchange Program shifted its regional focus, FAS definitely remains engaged on CARB in Africa. For example, FAS currently manages an agreement with the Africa Union to support their design and deployment of a project called Containing the Emergence and Spread of AMR in Africa. Examples of outputs to date include a survey of member states' priorities. I think there were 36 respondents to that survey. They've had delivered a handful of sub-regional training activities, and they have also begun networking to enhance AMR surveillance across the region. Earlier in the day, someone mentioned the USAID colleagues, I think, mentioned the regional One Health University networks, and that's been a good connection for us in the context of AMR and that program. I just wanted to mention. Concurrently, we're also collaborating with the Inter-American Institute for Cooperation in Agriculture, and that in the context of CARB, we are helping participating Western Hemisphere countries build their capacities for surveillance of antimicrobial resistant pathogens. Some of their outputs through that program to date include a new manual for on-farm interventions to prevent, control, and mitigate AMR in swine. They've done 8 laboratory twinning projects that assisted the participating labs to support AMR surveillance. That work is ongoing. FAS's work also aligns with CARB Target 5121. In short, as you heard, FAS supports the Secretary of Agriculture and our sister USDA and US government offices to coordinate USDA's engagements in international standard setting bodies or other multilateral organizations that address AMR with impact on US food and agriculture sector. And that was just indicated by my colleagues earlier in this module. Looking ahead, where and when appropriate, FAS will continue to support the US government's engagements with international organizations for learning about AMR, for promoting science-based solutions to AMR, and also for considering agricultural contexts for practical One Health approaches and AMR solutions. Next slide, please. Thank you. Just want to summarize a few of the challenges with a caveat to recognize that operating international programs is inherently challenging work. I'll close with two interrelated challenges that we deal with as we implement our CARB work. First, because FAS does not administer programs or other resources that are fully dedicated to health security, our planning of medium or long-term FAS commitments to CARB performance indicators is risky. Likewise, our situation challenges CARB-related program monitoring, evaluation, and learning. For example, potentially obscuring CARB within broader sanitary and phytosanitary or food security efforts across programming cycles. A related challenge, and I will wrap up, a related challenge that we're dealing with is the complexity of CARB, especially across diverse sectors and partner countries. We heavily rely on technical expertise of our sister USDA and US government agencies, many of whom you've already directly heard from today, and other partners. A lot of US universities and private sector partners assist us, collaborate with us to help us assess evidence about AMR in partner countries' CARB capacity building targets. We highly value such collaboration across our work, and definitely for CARB as we engage stakeholders, learn, plan, and act. So again, thank you for this opportunity to brief you.
Thank you to all of our speakers from USDA. We are running a little bit behind here, and so Council, on behalf of the Council, I'm going to ask a couple of questions, and then we will be transitioning straight into the CDC module. So Council members, if you have questions that aren't covered by the ones I ask on behalf of the Council, then let us know, and we can get you in touch with these folks later. But on behalf of the Council, to the folks from USDA, as we're preparing our report to provide recommendations, we're interested in feedback from USDA on two questions that I'm going to ask, and then anybody that can respond or would like to respond would be great. Number one, what resources or infrastructure gaps hinder your ability to lead global efforts on AMR in the agricultural space? And then similar but slightly different, what obstacles do you face in sustaining or increasing your ability to engage in those efforts? So I'll turn that over, and if anybody has comments, that would be great.
Maybe I'll jump in here. I think one of the from a resource standpoint, in terms of our ability to engage and to pursue whatever objectives and interests we have in the plant health area, I don't see that as a factor. I think the second question, though, about what obstacles are out there, it goes back to what I think was mentioned about capacity of other countries to engage and their ability to collect data and to really know what's going on in their own country, to be able to share with us. If, like, we do a survey here and trying to track data, it gets, you wonder about the quality of their ability to give us quality information on which to then develop reliable strategy and involve them in a way they need to be involved. So I would say that this capacity building issue has always been, in almost everything we do, an issue. And my organization is not funded to do capacity building. We provide subject matter expertise, but we approach international development and international capacity building with a little bit of caution, because we're not funded for that, but we are always willing to share the subject matter expertise that we have. So I think Mike alluded to this in the FAS piece, but I do think what they can do, other parts of USDA certainly help here in terms of addressing capacity building. Thank you.
Thanks. Anybody else comments?
I'll jump in. I think, Paul, to answer your question, this is related to one of your questions earlier this morning about data standardization and data normalization. And I see that as one of the challenges WOA has launched their ANIMUSE portal to collect antimicrobial use data, which in some ways I think we think of as the easier question to quantify use compared to like looking at resistance trends over time. But even that has had a lot of challenges, and the TAPVAR organization put together a paper recently to describe how the different TAPVAR countries are approaching that question in terms of the antimicrobial sales data collection that they're doing, as well as the antimicrobial use on farm, as well as like different population correction units that they're using in the different countries. And that's just a small level of highly resourced countries, and we have a lot of discrepancy between us. So when we try to apply that at a global level on antimicrobial use, it gets quite challenging. On the resistance side, I think it's equally challenging, especially because for a lot of the different animal bug drug combinations, we don't have clinical breakpoints to be able to define what is resistance. And so that gets really challenging, especially since a lot of the laboratories have different methods and again, lack of standardization makes it really difficult to aggregate data and make comparisons and, make actionable data. I think we all agree that data are really important, but you want to make sure that you have are comparing apples to apples on this important topic. Thank you.
Thanks. I will only add that another, I think, strength that if I could turn this issue around and maybe highlight on a strength and an opportunity regarding resources. Yes, we have scarce resources. We all do. Scarce time, scarce resources. That I think highlights the importance of interagency collaboration and coordination with our stakeholders. Someone mentioned assessment fatigue. These kinds of things are opportunities for us to communicate efficiently and clearly with our stakeholders and with one another, so that we're using our resources as effectively and efficiently as possible. Thank you.
All right. Well, I appreciate that feedback. And again, thank you to all of our USDA colleagues that have provided, insight into your efforts. As we transition, our last module today is focused on international activities of the Center for Disease Control and Prevention. We'll first hear from CDC's representative on the council, Mr. Michael Craig. Then we'll hear from Ms. Stephanie McBride on the Transatlantic Task Force on Antimicrobial Resistance, Dr. Dawn Sievert on the Antimicrobial Resistance Coordination and Strategy Unit, and finally, Dr. Paul Malpidi on the International Infection Control Program. I will not transition between each of you, so as you see your next slide come up, feel free to jump in and start your presentation. Thank you all for sharing your expertise, and Mr. Craig, you can go ahead.
Thanks so much, Paul. Appreciate it. And really appreciate the council's time here today to talk about CDC's global portfolio. Next slide. So I'm going to give an overview of that global portfolio and really touch on a limited view of CDC's global presence. There's not really enough time to go into all of our breadth and scope of everything that CDC does overseas, especially in areas that relate to antimicrobial resistance. But we are highlighting, I think, the major pieces that I think are most important to the council and the conversation at hand. Next slide. So the global burden of AR has already been mentioned several times, so I'm not going to go over it again. But I think the thing that I will spotlight from the CDC perspective is that CDC's specific mission is to protect the United States and the health of citizens from health threats. And that, of course, is inclusive of antimicrobial resistance, antibiotic resistance. And so that is our primary mission. Now, of course, doing that involves working in the One Health paradigm and working with a variety of partners. But just wanting to note and spotlight our unique capacity and our unique mission is specifically related to the health of the United States and the health of its citizens. So since 2016, the U.S. has made tremendous domestic investments and progress in addressing and protecting the U.S. from that. And we did, as we have talked to the council before, make tremendous progress in preventing AR pathogens between 2012 and 2017 and reduced domestic infections and deaths. That, of course, was largely reversed by the COVID pandemic, and we're now at a place where we're trying to get back on track with that. What I would note, though, is in our efforts to protect the U.S. and its citizens, obviously our mission has to be focused globally, paying attention to what's happening globally, and working with countries to protect their own citizens and to protect from the transmission of pathogens, including AR pathogens, from around the world. And so we started really domestically with our portfolio, and we have grown out from there to extend globally and to do more of that work overseas. Next slide. So these are sort of the main areas when we talk about working globally that we work in. Of course, a lot of this effort is done in collaboration with a variety of partners, ministries of health overseas, other organizations, our U.S. government organizations, many of which you've heard from today. But, you know, it is focused on these human health areas. So improving detection of AR threats, especially those that are novel, rare, or pose significant risk of morbidity and mortality, preventing and containing transmission of AR threats when they're identified. The P word that you always hear me go on about, prevention, is what you will hear me go on about on the global context, of course, as well as the domestic context. Improving the use of antibiotics and antifungals wherever they're used and needed. And then supporting public health innovations that can improve our collective ability to detect, prevent, or contain AR threats. And then last but not least, something the council has talked a lot about is raising awareness about the threat of AR among a variety of stakeholders, including healthcare workers, the public, policymakers, and those and subpopulations that are at risk. Next slide. So when we think about how do we organize our work and how do we think about our work, obviously, when we think domestically, we start with the AR threats report. This is the threat levels from the AR threats report, which I think many of you are familiar with. When we think about what we do globally, we use this also as sort of a benchmark of what pathogens are we looking for, what can we do in countries to protect and understand what's going on with these pathogens, especially the urgent pathogens and the urgent threats we've identified, and how can we work with those countries and international organizations like WHO to improve the detection of those pathogens and improve the prevention, reducing transmission of those pathogens, not only in that country, but around the world. So when we think of what we do domestically and what you'll hear from my colleagues, both Dawn and Paul, are targeted at these pathogens in different ways and trying to address that so that what we are building domestically is perfectly in parallel to what we're actually doing globally as well. Next slide. So as we've talked about before, and as you guys are familiar with the CARB action plan, there are goal 5 is focused on global. We wanted to highlight that there are major objectives, multiple objectives in which CDC has several metrics that are part of that, that we are actively working in. I'm not going to go into details on all of these. You guys can see them here, but wanted to note that we are very goal driven and want to make sure that what we are doing and what we are supporting is in line with the CARB action plan, and is also, would note to you that that last bullet, the National Biodefense Strategy and Implementation Plan, also includes an additional metric related to global work and supporting AR detection programs in at least 50 countries and establishing additional efforts there. And we have been working have very concerted efforts, as you'll hear later from my colleagues, to achieve all of these. Next slide. One thing I also wanted to flag for the council that's new and for all the viewers who are watching our great meeting today is that we are undertaking a new opportunity in collaboration with the CDC Foundation to try to bring together a coalition of entities including the Gallup organization, to improve our awareness and understanding of AR globally. I think this is a perennial issue that comes up and a major question that has come up about how can we improve awareness. What we're trying to partner with Gallup and the CDC Foundation to do is come up with a coalition of folks who could support an effort to do a global survey that Gallup runs and operates called the AR Monitor. And it would provide a survey of knowledge, attitudes, beliefs in countries around the world. That would then help us understand what are knowledge, attitudes, and beliefs related to antimicrobial resistance among the general public. I think they can also do targeted surveys among certain types of providers, so that we can understand what are the differences in levels of education, levels of understanding of the threat, and how can we then tailor our messages both from a national perspective and a country by country perspective, but also by multinational organizations like WHO. How can we tailor those messages to improve the level of awareness and understanding among multiple different countries, different populations that might be at risk, et cetera. So this is something that we're just undertaking. If you are interested in it, there's the email address to learn more information about it. We're actually kicking this off with a convening in Atlanta in February. Next slide. And so I think this is my last slide, but I do want to really emphasize before my colleagues go into greater detail of things is that really the main thing holding CDC back in doing more in the global space, which I think is true of a lot of the agencies that you've heard from today, is resources. There is no lack of desire. In fact, there is a tremendous amount of desire whenever we talk to other countries and partners to be able to do more, to support more activities in country. CDC's at its heart is a group of subject matter experts who know these issues very well from the laboratory side, from the clinical side, from the stewardship side. And our desire is to work and improve that both within our country and globally so that we can reduce the burden of these pathogens and we can try to get ahead of some of the challenges that we're facing, especially for some of the urgent pathogens I noted before. So our funding supports programs across CDC and works across foodborne, STI, respiratory pathogens, the healthcare associated infections. Almost 90% of these funds go to domestic activities annually. As I've noted, we've grown our global portfolio out of that. And the challenge is, how do we continue to grow that, and how do we continue to sustain that effort? I will note that we had some supplemental funding related to the pandemic that we had talked about, and I had shared some of those updates with the council previously. There was a rescission this past summer that impacted that and that reduced that funding availability. And the effect was that there was a dramatic reduction actually in our international infection control branch, which you'll hear from Paul more about later. And there was a 65% reduction in extramural funding because of that rescission, which directly impacts the level of support that the CDC provides on healthcare infection control and healthcare antimicrobial resistance transmission efforts, healthcare stewardship efforts around the globe. And so that's a challenge that we're trying to figure out how we can handle, how we can get to a new normal, and how we can potentially get to a place where we can get those resources back and even get to a higher level of resources to support more countries around the world. And with that, I will transition to my colleague, Stephanie McBride, who is going to go into our leadership work specifically in overseeing the Secretariat of TATFAR. Stephanie.
Thanks so much, Michael. Next slide, please. Good afternoon, and thank you so much for the opportunity to join you today and share some more information about one of our most successful global coordination mechanisms related to antimicrobial resistance, the Transatlantic Task Force on AMR, or TATFAR. For the past 14 years, TATFAR members, which now include the United States, Canada, the European Union, Norway, and the United Kingdom, have worked together to improve communication and enhance technical collaboration that strengthen our collective national, regional, and global efforts to combat antimicrobial resistance. TATFAR is unique in that it is intended to build bridges between technical subject matter experts of the TATFAR member countries and regions. Having this platform for experts to regularly convene, communicate, and coordinate on our AMR efforts is a unique and important value of TATFAR. The United States and the European Union are the TATFAR co-chairs, and as Michael mentioned, CDC serves as the TATFAR Secretariat. In this role, CDC's Antimicrobial Resistance Coordination and Strategy Unit provides support to the TATFAR co-chairs, the TATFAR coordinators that manage the day-to-day operations of the partnership, and all of the TATFAR working groups. The Secretariat also supports the planning of in-person and virtual meetings and manages the upkeep of the TATFAR website. Next slide, please. Subject matter experts from TATFAR members collaborate regularly across several technical areas that are defined in the TATFAR work plan, which covers an implementation period of 5 years. The 4 key areas in the current TATFAR work plan, which goes through 2026, are improving appropriate antibiotic and antifungal use, strengthening infection prevention and control, antimicrobial resistance surveillance, improving efforts that support development of new drugs, diagnostics, and alternatives to antimicrobials, and improving awareness about antimicrobial resistance and about TATFAR. The primary mechanism of engagement for TATFAR members include working groups that meet regularly and collaborate across implementation activities in support of these 4 key areas of work. TATFAR members also convene biannually via virtual meetings and also every few years in person. Monthly, TATFAR coordinators come together to talk about successes, challenges, and resolve issues in day-to-day TATFAR implementation. On this slide, I've highlighted a few key TATFAR successes, and more information about TATFAR progress is available on CDC's TATFAR website. Some of the TATFAR successes include establishment of mechanisms for ongoing technical collaboration between member governments, coordination of research and development efforts, collaborations on improved and novel methodologies for antimicrobial resistance surveillance, joint implementation of communication efforts such as those in support of World AMR Awareness Week. Next slide, please. TATFAR held its first in-person meeting since before the start of the COVID-19 pandemic in November 14th through 15th, 2023 in Luxembourg. And we'd like to take this opportunity to thank our colleagues in the European Union for hosting such a fantastic meeting. The meeting included government agency representatives from all TATFAR members, as well as other leading AMR experts. Participants discussed how to strengthen collaboration to address shared challenges in combating AMR and how to work together to develop tactics to fight this urgent global public health threat. Several important themes emerged from the meeting. Those include the need for continued discussions about challenges, successes, and lessons learned related to push and pull incentives and other mechanisms to increase access to existing antimicrobials and support the development of new drugs. The importance of effectively communicating about antimicrobial resistance to the public and what a challenge it is to do this both effectively within the budgets that we have and be able to measure the outcomes associated with these communications efforts. There was a lot of excitement about continuing TATFAR's technical collaborations on new scientific and technical development, including the development of phage therapy as a tool to treat and prevent the spread of antimicrobial resistance, and new advances in infectious disease modeling and AMR surveillance. Finally, TATFAR members recognize the unique opportunity that we all have in 2024 with the upcoming UNGA high-level meeting on antimicrobial resistance, and TATFAR members agreed to continue to leverage the TATFAR platform for coordination of our member state activities both in advance of and after the high-level meeting. I'll be happy to take any questions about TATFAR at the end, but right now I will turn it over to Dawn. Thank you so much.
Thanks, Stephanie. And good afternoon to everyone. And thank you for this opportunity today to share information on our CDC Global Antimicrobial Resistance Laboratory and Response Network. Next slide, please. In October 2021, CDC began work within the newly established CDC Global Air Lab and Response Network as part of Goal 5 in the U.S. National Action Plan for combating antibiotic-resistant bacteria. Almost all of this work is funded by CDC's Antimicrobial Resistance or AR Solutions Initiative, as Michael described, and we're currently in the first half of year 3 of our 5-year funding cycle. Through this network, we're striving for an interconnected global collaborative to address priority emerging AR threats, So we use a One Health approach to strengthen laboratory capacity to detect AR pathogens, to prevent infections in healthcare and the community through proven infection control practices, and to apply new and innovative ways to respond to AR threats, all to combat AR pathogens in healthcare, the community, our food, and the environment. Next slide, please. The Global AR Lab and Response Network, as Michael also mentioned, builds on CDC's successful domestic AR lab network by addressing critical detection and response gaps globally. So this includes building lab capacity for high quality AR testing and supporting outbreak response when threats are reported. The network builds upon and expands global efforts that are already underway or accomplished by CDC, public health partners, and collaborating countries. So it's intended to better coordinate and collaborate across efforts without duplicating, while enhancing communication between laboratory and epidemiology, and also fostering knowledge sharing among network partners. Next slide, please. The bacterial and fungal pathogens addressed within the Global AR Lab and Response Network match those within our domestic efforts. These have been identified, as Michael showed earlier, as our top priority AR pathogens that impact human health. And these are all described in detail in our CDC AR threats reports. These include healthcare-associated infections with a large focus on carbapenem-resistant Enterobacterales and Acinetobacter, enteric pathogens with a focus on drug-resistant Salmonella typhi and non-typhi, resistant Neisseria gonorrhea, emerging resistance among Streptococcus pneumoniae, Neisseria meningitidis, and Bordetella pertussis, and drug-resistant Candida auris and other Candida species. Next slide, please. As I previously mentioned, we use the Global AR Lab and Response Network to connect and collaborate across existing AR work. So under this umbrella of AR efforts across the One Health spectrum, the healthcare-related efforts are conducted through the Global Action and Healthcare Network, or GAIN AR module, as well as the Antibiotic Resistance in Communities and Healthcare, or ARCH projects. The resistant gonorrhea work uses the Enhanced Gonococcal Antimicrobial Surveillance Program, or EGAS protocols. The global focus on Candida auris and other Candida species follows specific protocols that result in an upload of antifungal resistant data into the World Health Organization's Global Antimicrobial Resistance and Use Surveillance System, known as GLASS. A number of enteric pathogen-focused efforts are conducted through PulseNet International, while others build off of CDC's Global Water, Sanitation, and Hygiene, or WASH efforts. Next slide, please. This slide shows the comprehensive picture of the extensive AR work being conducted across specific countries around the globe. As you can see, we have a very broad reach, and some countries have multiple efforts underway to address different resistant pathogens. As of 2023, the network has grown to span nearly 50 countries and working with more than 20 organizations worldwide. Next slide, please. We are not yet halfway through our 5-year funding cycle, and already we're seeing great progress through the efforts made. Some specific accomplishments include more than 420 Bordetella pertussis isolates have been tested for macrolide susceptibility and resistance in Brazil and Mexico. More than 50 personnel from 6 hospitals in Indonesia have been trained on media preparation, specimen collection and processing, and identification of Streptococcus pneumoniae. We're actively engaged within 8 countries to increase capacity to detect and respond to C. auris, including antifungal susceptibility testing, whole genome sequencing, and point prevalence surveys of high-risk healthcare facilities. More than 200 participants from 42 labs have been trained on bacterial pathogen identification, antimicrobial susceptibility testing, and data integration into the national AR monitoring system in Brazil. 14 community interviewers have been trained to administer a WASH survey, as well as collect water samples and conduct water quality testing for an environmental surveillance program in Kenya. And we have implemented the EGAS work in a handful of initial countries, including Cambodia, Philippines, South Africa, Thailand, Uganda, and Vietnam. Next slide, please. In April of this year, we held the 6th CDC AMR Exchange webinar in our series. As you can see, it was titled Combating AMR Together, CDC's Global AR Lab and Response Network. The purpose of this series of AMR Exchange webinars is to share information on cutting-edge research and impacts in the field of AMR, drive the field forward in our efforts to combat AMR by sharing what we're learning and what's working, and to engage partners, practitioners, policymakers, and public to collaborate across One Health, including healthcare, industry, community, and the environment on AMR topics. In this specific exchange, the participating experts discussed how CDC partners in the global AR Lab and Response Network address antimicrobial resistance threats and meet critical prevention, detection, and response needs across One Health. And we focused on a few of our specific projects that cover Candida auris, carbapenem-resistant enterobacterales, and enteric pathogens. Next slide, please. Through this work and beyond, we continue to advance and promote CDC's AR portfolio. This includes leveraging existing relationships and engaging new partners, both internally at CDC and externally with all of our partners engaged in the AR space globally. We continually strive to make impactful contributions to the global AR community in meaningful ways. And this includes continuing to emphasize the need for a One Health approach to AR, providing technical assistance for development of AR national action plans, again, striving for that One Health focus and not just on any single sector, encouraging and showing value for countries to submit data to global surveillance systems such as WHO GLASS, and we're working to ensure the sustainability of our projects by helping programs, recipients, and country and regional leadership to maintain ongoing impact that will continue beyond our current efforts and direct funding. And some of the approaches we're taking include capacity building focused on strengthening labs at both the national and subnational levels, while increasing engagement with ministries of health and other relevant decision makers, and working with partners to show the value of all this work to establish and maintain the needed buy-in for ongoing support. Next slide, please. We see the Global AR Lab and Response Network as a way for CDC to strongly contribute to the efforts of the global AR community. And in addition to these funded activities that I've mentioned, ARX has many other relationships across the global community doing work in the area of antimicrobial resistance. For example, we lead 2 of the WHO AMR network collaborating centers covering both bacterial and fungal pathogens. We serve as representative or board member on a number of global and domestic advisory groups and committees, and we have direct engagements and collaborations with many external AR focus groups and organizations. You'll recognize on this slide TATFAR, as Stephanie has already described, as well as PACCARB and the CARB Task Force, and WHO STAG AMR and CEDRIC, among many other partnerships. Next slide, please. Thank you again for this opportunity, and now I'm going to hand it over to my colleague, Paul Malpede. Thank you.
Thanks, Dawn, and thanks, everybody. It's great to be here today to talk about the Global Action Healthcare Network, or GAIN, which, as Dawn mentioned, is part of CDC's Global AR Laboratory and Response Network. Next slide, please. GAIN was launched in December 2021, and again is a global collaborative network of countries, institutions, partners working at global, regional, national, and subnational levels. What we're doing is really working together to address priority emerging infectious disease threats in healthcare settings through rapid detection, prevention, and response. As mentioned, GAIN is part of the Global AR Lab and Response Network, and we have 2 modules, the Healthcare Associated Module, Healthcare Associated Infection Module, or GAIN HAI, which I'll touch on briefly, and I'll focus more on our antimicrobial resistance module, or GAIN AR. Next slide, please. GAIN as a whole is being implemented in 13 countries in a collaboration between CDC and many partners, academic partners, non-governmental organizations, ministries of health, and other colleagues. You see we have good geographic representation working in Latin America, East Africa, Southern Europe, the Middle East, and South and Southeast Asia. Next slide, please. Partners report, as it currently stands, to one of two modules in the GAIN network, the HAI module or the AR network. Ultimately, we have a vision where countries will be reporting to both modules, but as we're in the early days of implementation, countries are focusing on reporting to one of the two modules. I'll start by discussing the GAIN HAI module, focusing on healthcare-associated infections, which we're currently implementing in Brazil, Jordan, Indonesia, and the Philippines. Next slide. Just quickly talking about GAIN HAI, we're really looking at detecting and preventing healthcare-associated infections in hospitals in these countries, including those that are caused by antimicrobial-resistant pathogens. And ultimately, we will be able to collect and capture data about the pathogens that are causing these HAIs. The GAIN HAI team is working to assess existing HAI monitoring systems and infection prevention and control capacity at participating hospitals, and working on conducting baseline HAI point prevalence surveys at these network facilities. Based on the results of those baseline point prevalence surveys, the hospitals will be implementing evidence-based IPC interventions that are focused on particular HAI prevention priorities informed by the data. And there will be ongoing serial point prevalence surveys and other monitoring approaches to inform future IPC interventions. Next slide. What we'll focus on today, though, is the GAIN AR module, which is being implemented in Argentina, Brazil, Belize, Chile, Costa Rica, Greece, Ecuador, Ethiopia, India, and Uruguay. Next slide, please. GAIN AR is a network that promotes action against antimicrobial resistant threats in healthcare settings through a cycle of prevention, detection, communication, and response. Next slide, please. GAIN AR works to prevent and reduce the spread of AR in healthcare, particularly in low and middle income countries. We're focusing on detection and communication, prevention and response, and preparedness. We know that in many places where we work, there aren't great connections between laboratory teams working on clinical specimens and infection prevention control and clinical teams who are managing patients and implementing IPC interventions. So a big focus of GAIN AR is really this detection and communications piece, where clinical and reference laboratories are rapidly trying to detect and communicate the detection of targeted or antimicrobial resistant organisms. At the same time, clinical and national IPC teams are rapidly responding to those identified threats to prevent transmission and also implementing proactive prevention and rapid response measures. We're also in the background working to prepare these hospitals to respond to future threats, strengthening their capacity in terms of laboratory and IPC programs, improving and innovating in detection and response strategies against AR. And GAIN, it really provides a forum for countries and hospitals that are participating in the network to share experiences and build global partnerships to learn from each other. Next slide. GAIN AR is initially focusing on detecting, preventing, and containing carbapenemase-producing CRE or CPCRE in healthcare settings. And particularly within the big three CRE, so Klebsiella, E. coli, and Enterobacter species. We want to pilot the GAIN work to make sure that the activities that we're proposing are feasible, and knowing that we'll always be able to expand to additional organisms informed by local epidemiology in the hospitals in which we're working. Next slide, please. GAIN AR's approach is to put together a network of laboratories and IPC teams that collaborate to rapidly detect and respond to AR threats. We're implementing the network in collaboration with implementing partners who have roles to play in both laboratory and IPC. On the laboratory side, implementing partners are collaborating with clinical labs at hospitals participating in the GAIN AR network, along with a reference laboratory that's available to provide additional characterization of AR threats that are identified at the hospital level. These laboratory teams have access to CDC's lab experts and resources to build their capacity to detect AR threats. On the IPC side, implementing partners are also collaborating with hospital IPC teams and regional or national IPC teams or programs to put together IPC programs to respond to the threat of AR transmission in healthcare facilities. Again, working very closely with experts at CDC to help implement IPC responses. Next slide, please. GainAR is early in its implementation. As I said, we launched the network in December 2021. Over the course of 22, a lot of work on building relationships, obtaining required approvals, and really seeing a lot of activity scale up over the course of calendar year 2023. And these participants have been able to increase their capacity, expertise, and readiness to respond to AR threats using CDC-developed resources and also on-the-ground technical assistance to build their capacity. We've delivered over 350 laboratory and IPC trainings. We've conducted over 160 IPC and laboratory capacity and practice assessments. We've developed both cross-cutting GAIN network-wide resources, but also over 50 local IPC protocols, standard operating procedures, job aids, or checklists to help GainAR IPC teams implement their prevention activities. We've built the capacity of 16 laboratories to implement new methods they weren't using before to detect CPCRE. And we've seen multiple hospitals really building up their IPC programs, introducing auditing or the implementation of IPC practices that can prevent the spread of AR organisms in healthcare, such as contact precautions, for the first time. Next slide. With that, I'll turn it back to Michael just for some closing remarks and to transition into the discussion. Thank you.
Thanks, Stephanie and Don and Paul. And I think it's time for discussion, so I'll turn it over to Paul Plummer.
Yes, thank you. And council members, you can raise your hands if you have questions, and Sarah will moderate for us as we proceed. We have a little bit more time. We gave each agency the same amount of time, so this question and answer session is a little bit longer than some of our prior ones, so feel free to raise your hand.
Lucas, the floor is yours.
Thank you. Thank you. Great presentation. And I have a question. Several of you mentioned funding and the barrier that funding implies for you to, for agencies like CDC to implement some of these great programs around the world. And I'm thinking, is there or has there been any talk about creating sort of a global fund to be able to, be able to sustain some of these initiatives globally in perpetuity?
So I think that's a great question. And I think you're actually getting at the heart of one of the issues that is probably going to be top of mind for the UN General Assembly high-level meeting in September. I think the issue of financing and sustainability globally for implementation of national action plans, prevention programs, vaccination programs, other things that are directly related to AR, I think is a major issue. And I think it's a major question mark. I think there are some organizations like World Bank who have started to move into this space. And I think there's more movement that could come. I think there are also some mechanisms and some precedents with things like the Global Fund where they potentially could be leveraged, and people have talked about them being leveraged more broadly for AR. I don't think that there's any sort of clear international consensus around that yet, but I think it's definitely one where there does need to be additional resources if we're going to make the needed progress across the board.
Dr. Newland, please.
Thanks, everyone. Great. Thanks, Michael. As always, great seeing you. Where does the intersection of TAPFAR and the Global Action and Healthcare Network come across? And then secondly, is in the Global Action and Healthcare Network for LMICs when we're talking about IPC and LMIC versus some of the community-based infections, as I'll probably keep saying over and over, the neonatal sepsis, antimicrobial resistance is out of control. Where is that kind of link? And I know Padmino will probably go there too, hopefully. But I am curious on those two, TAP4 overlap and the Global Action Network work.
Yeah, and I'll let Dawn and Paul go into more specifics about the LMIC and the community versus healthcare, which is always sort of a challenging divide, especially in low resource settings. A couple things I'll just note on the TAPFAR side, with the global work in GAIN and Garland right now, there I would not say that there's a significant amount of overlap right now, just because TAPFAR members haven't taken that one specifically on as a working group area and an area of further exploration. I think as we are going to beginning discussions on the next iteration of the next 5-year plan of TAPFAR, I do expect that to probably be one that TAPFAR members contemplate, specifically a work group around what countries are supporting other countries through bilateral or multilateral aid. What does that look like? What are sort of our lessons learned, and what is sort of the technical know-how from that? So I think that is going to be a valuable one, and one that is definitely on our radar. So I thank you for raising it. I think before I turn it to Dawn and Paul, the one thing I will note is, on the community and healthcare divide, I think one point in particular that we have seen over and over again, both from the US perspective as well as globally, is that when you're talking about any infectious disease, whether you're talking about a resistant pathogen, whether you're talking about COVID or whatever, healthcare is one of the key areas that every country has to have a strong infrastructure around. Because what we see from a public health perspective is, if it's not strong, healthcare is going to either be the control point for that infectious disease, or it will be the magnification point of that infectious disease. And for a lot of these pathogens, we see a problem in the community coming into healthcare and then just getting magnified multiple times worse with sick populations and poor infection control and other things. So I think it's a great point, and one where we definitely have to have assets in both areas, but it's also one where we see we need to strengthen that linchpin. But Dawn and Paul, do you want to add to that?
Yeah, I think you're spot on, Michael, about the importance of healthcare, and that's really what we're trying to focus on. The thing I'd add is the capacities we're building and gain in healthcare really ideally would help us identify things that Michael's talking about, such as even the emergence of a novel mechanism. I think we've seen plenty of situations where novel mechanisms emerge, they're amplified in healthcare, and before you know it, it's a problem in the community as well. So I think that focus on healthcare is really important. And I think there are other platforms in the Global AR Lab and Response Network that our branch is working on that are looking at some of the community issues, but I think Dawn could speak better to that. Dawn, over to you.
Thanks, Paul. Yes, so there is actually a specific project, and we mentioned GAIN, we mentioned the ARCH projects. We also mentioned things like animal health, looking at waste and water. So we actually have a project right now, it's in Guatemala, but it's tying in our ARCH project, connecting our animal folks, and then eventually connecting our water folks to all work together to look at what's happening, from and out of the healthcare into the community, with all of those One Health sectors being considered. And so we hope that under the Global AR Lab and Response Network, those are more types of projects that we can grow as we pull all of our subject matter experts together and look at where we are and who's doing what, and start seeing those connected ties. I'll also mention with TAPFAR, like Michael said, these are high income countries talking to each other, but my specific work group covers emerging and concerning pathogens. And when we do talk across all of our efforts, we do then say, how can we help? How can we work further? How does this affect low and middle income countries? And where are each of us working in the space? So we try to keep each other abreast of that information as well, so that we are working together globally, not duplicating. Thank you.
Robin, the floor is yours.
Yeah, thank you. This is for Michael. It's really a comment. AMR is so complex because it's so many organisms and so many antibiotics, so many diseases, really. The list that you put out on AR pathogens that pose a significant risk of morbidity and mortality is really helpful, and I commend you on that. I do think it's pretty short. And if you compare it to the WHO's list, which granted has a slightly different premise, it is a little different. So that I just really want to share has been helpful in so many spheres, but please continue to update it and think about whether it needs to be expanded, because this is really such a challenging problem.
So great. Really appreciate the feedback, Robin, especially from someone who is so intimately involved on a day-to-day basis with all of these issues. Really appreciate that feedback. And And I couldn't agree with you more. I think whenever we look at the threats report, we are honestly always thinking about that. What are we missing? What are some of the other things that are on the horizon? In the 2019 iteration, we added the watch list, which was sort of a new feature of the report, to add specifically those areas where we're getting anecdote, we're getting outbreak, but we don't necessarily have the hard data that we have for the other pathogens, but they are things that we're paying attention to. And we want to make people aware that there are potentially growing concerns in these other things and that we're watching them. So I think that you are going to see in future iterations of the report, both an expansion of pathogens that are on the actual threat list, as well as an expansion of things that are on the watch list.
Thank you. Go ahead, Tim.
Great, thank you. And Michael's point about the reduction in funding, I don't think we can underestimate the importance of that. And I think the council really has to take that into consideration as we are designing advice that we would give going forward. The situation of relying on piecemeal approaches and then having things reduced is particularly damaging if we want to be able to have global impact and bring in partners globally. I did want to highlight, though, that the Global Fund does have a funding facility now for laboratory capacity building. So there is a seed emerging there that is a positive sign. My question to CDC, though, and this relates to GAIN and ARCH and the other things, it's partly answered, but what do you see as the role for CDC supporting and fostering innovation and innovative tools being deployed, particularly in a low resource setting? There's great opportunity in these things. Is that something that you see that CDC can support, or should that come from others? Thank you.
Thanks, Tim, and great points all around on the financing, and agree with those. And I'm happy to start, and certainly can turn it over to Paul and Dawn if they have additional points they want to add here. But on the innovation side, we are absolutely, I think, interested in serving a role as we see fit. I think public health, generally speaking, often fills the gaps, and in some places there are significant gaps on what can be delivered. So when we think of innovation, yes, we are looking at what are innovations that could be applied to an infection control context, to improve the quality of infection control that maybe does different things and provides, as care is provided differently in different countries. How can we make sure that it's maintained at a higher level? I think we're also interested, as we have talked to the council about potential interventions, and that we've worked with FDA on, that could reduce therapeutic reductions in transmission. Can we do something that reduces or impacts the microbiome so that we have less shedding, so that we have less colonization? The ARCH studies in particular are the only studies that I am aware of, really, that around the world, that are looking at colonization of AR pathogens in a very substantive way to try to understand what are these chains of transmission that are happening between community and healthcare. And I think we specifically want to see, once we understand these well, what are the interventions that are most key? Some of those interventions might be very basic in terms of water and sanitation. Some of them, though, might beg for innovative approaches and new approaches, new therapies that could be applied. And we're certainly open to using our sites or working with others to help implement that. Paul, is that fair?
Yeah, I think that's fair, Michael. I think what we're trying to do is build platforms and not do individual projects, right? How can we use these things that we're building to do the types of innovation, even within those networks?
I think I can just add that what we want to do, and we talked about funding that's been mentioned, our partnerships are vital. So when we work across our partners who are in space of different angles, and if they are working on diagnostics or they're in country and they're trying to bring, say, a new testing platform to the laboratories there, us being aware of what's going on so we can say, okay, let's help move this forward. How can we get availability for this testing platform and that sort of thing, to be able to continue to move the LMICs forward as we expand our capacity building? And those partnerships are vital.
Thank you, Dawn. Padmini?
Thank you, and thanks to all my CDC colleagues for great talks and presentations. I want to underscore again what Tim said and others have said on scalability and sustainability, and obviously the need for resources to enable that. And sort of in line with that, I wondered if you could comment on the activities and pilot projects and other collaborations that you have and how they're already incorporated or are being incorporated into national action plans, as well as you talked about regional networks and how has it started to manifest in ways of across regions, across countries, between countries, and also with other efforts at surveillance. I saw Cedric was mentioned in one of the slides. I know Wellcome Trust is supporting enhanced and better AMR surveillance as well. And I ask this because of ultimately, in order to be sustainable and scalable, we need to look not only at what's technical achievement, but also what's the most cost-efficient way to get the data needed to enable the right interventions. So wondered if you could comment on those issues.
Absolutely, and I think I'll turn that directly to Dawn and Paul to talk about it on their platforms.
Sure. Yeah, go ahead, Dawn.
No, you go first. I was going to say, go ahead.
Great. Yeah, hi, Padmini, great to see you. I think to your question about the stitching these networks together more regionally, that's something that I think Dawn can speak to as her unit's trying to coordinate that within Global AR Lab and Response Network. Additionally, in the network that we're supporting, the GAIN network, one of your points that resonates is the need to kind of integrate not just regionally, but also nationally, right? Doing things in collaboration with ministries of health to make sure that these can be integrated and scaled. I mean, we don't have the resources to build national level programs. What we want to be able to do is demonstrate that we're able to make success at a small level in close collaboration, not just with the NGO partners or the academic partners, but the ministries, to work with them to figure out ways to scale. At the regional level, one of our implementing partners and our collaborators in GAIN is PAHO. I think it's been an interesting experience to kind of work with them to think about how they could go from pilot sites in Argentina and Chile to a larger number of countries. So I think even within the platform, we're trying to identify opportunities to scale regionally. And I would just add that CDC, is moving towards a regional approach to working, and both Dawn's unit and our branch, have relationships with CDC's regional offices to try to learn more, figure out ways to not just put data together, but to collaborate and implement more effectively through regional forums, regional groups. We're trying to put together, for example, a survey, a multi-region survey delivered in collaboration with the regional offices, looking at the capacities in healthcare to deal with CROs and try to generate some regional and global data to kind of illustrate the gaps that still remain. So I think we're still working through it, but there are plenty of forums that we're pushing forward in. Dawn, over to you.
Thanks, Paul. And yeah, that was great coverage. I think just to add on it, to acknowledge that our vision for the Global AR Lab and Response Network is absolutely to build a network, right? A global network. So across all the work of our subject matter experts at CDC and all of the pathogens, bacterial and fungal that we talk about, in addition to the partners that we work with globally. Now, again, like I said, we're just 2 years and 3 months into the Global AR Lab and Response Network, and we started it during COVID. So it was a little bit slow in getting up and running, but as both Paul and I showed on our slides, there's been a lot of progress already made. But like Paul said, our focus now that things are underway and we've got a foundation established is to really look at the work that we're doing and where it's happening, to tie in across our subject matter experts, as we've already described, to work with the country and regional offices that are CDC affiliated, like Paul mentioned, but then also to look at the ministries of health, What is WHO and PAHO doing? Again, I mentioned we are a collaborating center, and we very closely link this work with their needs that they ask of us as a collaborating center. Looking across our other federal partners and the work that they've talked about and presented today, and us being aware of how we can link things, work together. And then all of our external partners. We have calls with individuals. We share and we hear back on where groups are and what they're working on. And like Paul said, it's underway. There's a lot of effort and work that we still need to get to tie all of this better together. But that is our vision for this, to, again, not be duplicative. And in not duplicating, but being effective and efficient, hopefully then we will be able to work better together with the funds that we have and the ability and the staff and the support that we have to do it, to make it sustainable. Thanks.
Thank you. Doctors Black and Kwan, you guys will have the last two questions. Stephanie, go for it.
All right. Hi, everyone. Thank you so much for those terrific presentations from CDC. And I think I had much the same question as Padmini. So I was going to also ask about leveraging some of the other federal agencies that we heard from this morning. It's so fantastic to hear how much you all are providing access to molecular diagnostics and infection prevention and control at the front lines. But I was just wondering about the intersection with USAID, given what Jessica Perillo had talked about, and as was discussed, local involvement and reaching out in terms of leveraging that to have more of a regional response, which I think is much of what you just talked about. So you may not have much more to add about that.
No, I think, Stephanie, thanks for flagging it. I think it's always a critical issue. I think there's a great history of working together, especially between USAID and CDC for implementation of PEPFAR. Jessica had flagged that earlier. CDC is one of the key implementing partners of PEPFAR, and so there is a great precedent and longstanding support there. I think for both organizations, the specific work on bacterial and fungal pathogens that we're talking about specifically in the threats report, I think there's a need for greater resources. I think that the resources there can, of course, be potentially leveraged by other platforms, and there might be opportunities for us to do new things, to collaborate together. I think we're always open to it, and I think it's one of those things that we always have to keep coming back to is how are we working in unison across the US government and leveraging and relying upon everybody's sort of comparative advantage to be able to impact positively the most number of people and address this as in as many places globally as possible.
Thank you.
So thanks for the CDC colleagues for those rich presentations. So a key point I'm hearing here, especially with so much ARCH work, is the importance of colonization, not just infection. So essentially the ability to perhaps detect colonization, to then develop methods to prevent subsequent infection and transmission. Can you comment a little bit more on that importance versus colonization versus infection and how we can leverage that understanding to combat AMR?
Yeah, absolutely. And great to see you on the council, Dr. Kwan. So would say fundamentally, colonization and how do we address transmission is one of the areas that CDC sees as one of the pathways forward for us to really get ahead on the prevention side and address antimicrobial resistance writ large. That is true both domestically and globally. Domestically, we have done a lot through research projects in other areas, our prevention epicenters, and work that you have done, Dr. Kwan, as well as Susan Wong have done in looking at colonization specifically in areas like nursing homes and long-term care settings and hospital settings, and how do we minimize the transmission of these pathogens in people who may not even know that they're carrying these resistant organisms in their gut or in their skin or on other body sites. And so I think we see that there's a tremendous opportunity to potentially have new interventions, therapeutic interventions, potentially non-antibiotic interventions that could be used. We already have things like chlorhexidine bathing and mupirocin that are used in a lot of U.S. healthcare facilities. I think the ARCH work is, as I noted, I think seminal work to try to understand what some of these dynamics are globally. And I think the important thing is that the colonization dynamics in the US, of course, are not going to be the same as they are in other countries. And so I think ARCH is getting at specifically exploring that, and what are some of these other interventions that we could do in some of these other sites, and how can we mitigate transmission both on the community side, but also on the healthcare side. Paul, anything else you want to add there?
Yeah, and it's a great question, Dr. Kwan. One thing I didn't mention in the GAIN AR spot is colonization screening is a huge part of the work that we're doing there, because we know that's a huge gap in many LMIC facilities. There's just no capacity to do colonization screening. As part of GAIN AR, we're really kind of building the capacity for facilities to do that in targeted units to identify colonized patients, which is something that's just not commonly happened in many of those places. So it plays very much into the healthcare work we're doing as well.
Great, thanks. Well, with that, we're going to close out the discussion session. I want to take a moment and thank all of our CDC colleagues for coming and talking with us today. Really, really great presentations, and we very much appreciate you all staying in time, as well as our USDA colleagues.
Produced by the U.S. Department of Health and Human Services.